A global pandemic spreads across the globe. Healthcare systems buckle under pressure. As the first wave of COVID-19 sweeps across Ontario, hospitals are stretched to capacity. Frontline workers quickly realize the biggest obstacle is an acute shortage of personal protective equipment. How can ONA members care for the sick without exposing themselves to an increasingly deadly virus? As access to PPE turns into a national crisis, some for-profit long-term care homes are keeping it under lock and key. Efforts to access protective equipment is refused, and ONA hits back with a legal challenge.
We have to do something. This is an emergency.
The ruling is swift. ONA wins in court, and workers receive the equipment they need to keep safe. As COVID-19 ravages elderly populations, long-term care homes across Ontario bear the brunt. The death toll among residents and workers climbs rapidly. ONA member Brian Beattie, a registered nurse in London, is among them. Our members are heartbroken. But long-term care is in desperate need of frontline nurses, support staff, and supplies. To stem the tide, members of Canada's military are deployed in the hardest-hit facilities. Their final report outlines devastating conditions across Ontario's long-term care system.
It is extremely troubling.
But the horrifying conditions are already well known to ONA members. Member actions have been pointing government to problems for months. Well over 400 calls to the Premier's office, hundreds of social media posts, thousands of email messages call on Ontario to effect change. As the Long-Term Care Commission unfolds, ONA is there to share stories, table recommendations, and to get loud about improvements in the long-term care sector that so many vulnerable Ontarians depend on. As the world wrestles with a stubborn global pandemic, and registered nurses step up across the province with skills, knowledge, and critical thinking, it's ironic to learn of hospital layoffs. Lakeridge Health, Toronto Rehabilitation Institute, and South Lake Regional Health Centre collectively eliminate more than 140 registered nurse positions, all in the name of saving money. The impact on patients? More than 260,000 hours of direct care is lost. ONA President Vicki McKenna's voice is heard across mainstream media.
There's so many actions that should have come into play really quickly, and they didn't.
And ONA launches a major public awareness campaign highlighting the power of RNs. The message? The cuts must stop, and they must stop now. Our voice resonates loud and clear through our communities and across the province. These devastating cuts will harm patient care. As Ontarians show historic levels of support for frontline workers, the government rams through 3 bills stripping Ontario workers of their rights.
100%.
Bills 124, 195, and 197 limit wages, interfere with our collective bargaining rights, and grant extraordinary powers to override existing laws and constitutional rights. As Premier Ford systematically eliminates worker rights, ONA takes swift action. In protest, members launch more than 44,000 emails to Premier Ford and his ministers. At one point, almost 800 per hour. ONA launches a charter challenge. As we make our way through the courts, frontline advocacy ramps up. Hundreds of members, colleagues, and friends rally outside the offices of MPPs across Ontario, demanding the withdrawal of these draconian bills. As the pandemic continues on, our ongoing commitment to patients, residents, and clients, to our healthcare partners, and to each other, is a testament to our strength and resilience. Be safe, stay involved, and be heard.